Hi, one of our subscribers have asked this question. What happens if you take an overdose of thyroid hormone? Someone requires, say, 1 or 2 tablets of thyroid hormone. They continuously take 4 or 5 tablets daily for weeks together. Or someone takes a very large overdose of thyroid hormone. For example, a kid swallows a lot of thyroid hormone. What will happen? Okay. So the answer to that is very simple. In the former case, when someone is taking a chronic overdose, what will happen is that the TSH will go very low. It will get suppressed. It will go to less than 0.001. It will not be detectable. But apart from that, the patient may experience some symptoms like palpitation, sweating. These are hyperthyroid symptoms. But once the patient stops the drug, the overdose, it improves. And paradoxically, many patients who are taking a very large dose of thyroid hormone do not feel these symptoms. Why? Because in the body, T4 is what we take. This gets converted into T3. It also gets converted into an inert hormone called reverse T3. So if you take excess of T4, the T4 becomes excessive, then instead of it going equally to T3 and reverse T3, more of it will go to reverse T3. All right, more of it will go to reverse T3. So this is called deiodinase enzyme. So deiodinase enzyme protects the body against over replacement. So if there is an excess production of T3, then it's a problem in hyperthyroidism. In hyperthyroidism, the body produces T4 as well as T3. But if you give an overdose of T4, usually nothing happens because the body has a protective mechanism. It converts the excess T4 into reverse T3. So this is a very easy way to understand that thyroid hormone overdose does not cause any clinical symptoms, though it can cause a low TSH. So this is on a chronic basis. In an acute basis, we need to consult the doctor. You need to go to the emergency room. See if someone has taken a very large dose of thyroid hormone. Probably an observation of a day or two, depending on the clinical status of the patient, is required. For example, very young children or very elderly adults, if they take an overdose of thyroid hormone, usually it causes some problem. But what I have seen in clinical practice, young or middle-aged individuals, young adults or middle-aged individuals who take levothyroxine overdose, nothing usually happens, and we usually discharge the patient after an observation of a few hours and probably ask the patient to come for a follow-up on OPD basis. Thank you.